strategy. I uphold health as a human right for all, including people with disabilities, while embracing gender equity and equality. I'm committed to ensuring universal access to quality healthcare and strengthening health systems to meet the needs of the present and future generation. Honorable Chairperson, I commend the WHO in collaboration with the government and other stakeholders for its outstanding work in improving health outcomes and well-being, as evidenced by the significant progress made across various health indicators. However, today, Africa stands at a turning point in its history because of the complex challenges that call for an urgent and collective action. These include financial crises we see, geopolitical instability, impacts of climate change, infodemics, the growing issue of antimicrobial resistance, the pressing realities of pandemics, and other public health emergencies. Honorable Chairperson, I've been a senior advisor on health policy and nutrition to the former President Jakaya Kikwete for 10 years, from 2005 to 2015, and currently to President Samia Suluhu Hassan. I've had the opportunity to advise the highest political office in our country on the transformative needs in the health sector. This position has allowed me to spearhead initiatives which have impacted positively in the fight against health crises and establishment of systems that continue to deliver tangible results. So what qualifies me for this service opportunity? I believe that Africa, where it stands today, deserves a leader who not only has the vision, but also the proven ability to deliver results with efficiency and transparency. The challenges we face as a region today demand a bold and practical leadership, someone who understands the realities on the ground, someone who can work with government and other stakeholders to mobilize resources, and someone who can create tangible partnership to address them. I believe I'm such a leader. During my practice, I've witnessed people missing out on healthcare for lack of finance, and families parting ways with their possessions, the very means of livelihood, just to pay hospital bills. Yet, despite making these heartbreak sacrifices, many still find themselves trapped in debt and poor health conditions. For me, this is a harrowing experience. Out-of-pocket healthcare costs have pushed countless families into the depths of extreme poverty, thereby recycling poverty. This requires urgent solution. I believe universal care is the solution. Honorable Chairperson, I have a long experience in training, research, and working abroad, followed by many years of hands-on fieldwork across the African region. Throughout my career, I have worked with heads of states, ministers, parliamentarians, community health workers, philanthropies, private sectors, NGO, civil societies, financial institutions, and faith-based organizations. My track record includes transforming healthcare systems from the ground up, even in the extremely challenging and resource-constrained environments. How did we do it? By pioneering innovative healthcare financing, building a stronger health workforce, building infrastructure, initiating outreach services, and successfully managing public health emergencies. So what gives me assurance in my track record? Trust is built on results. My contribution to healthcare is undeniable. I understand the challenges ahead. I bring the new resolve to address them. I'm not only ready for this challenge, but also uniquely equipped to address them and deliver the transformative change our continent urgently needs and expects from us. Having visited many member states, over 30, I recognize the urgent need for a fundamental shift in how WHO Afro responds to specific country needs. I will drive this transformation, ensuring a more agile, country-focused, country-owned, and impactful organization. Chairperson, now I would like to highlight some key personal experiences and achievement. My first point is on strengthening health system. As the founder and first CEO of the Jakaya Kikwete Cardiac Institute in 2014, we were able to reduce overseas referrals by 95%, saving the country more than $10 million per year. The funds saved are now being reinvested in strengthening PHC and financing patients who cannot afford hospital bills. Again, how did we do it? By building in-house human capacity, investing on infrastructure, advocating for an increase of health budgets, engaging private sector, financial institutions, and fostering global collaboration. The Institute has become a regional hub that performs more than 4,000 intervention procedures and open heart surgeries annually, ranging from pacemaker insertion to bypass surgery. Currently, it serves patients from across Africa. Honorable Chairperson, in 2022, I was appointed CEO of Muhimbili National Hospital, one of the largest hospitals in the region with 2,400 beds and 4,000 staff under me. The hospital attendance on average is 3,000 patients per day. Furthermore, I oversee an outreach to a network of 12,200 satellite healthcare facilities across the countries through telemedicine, e-medicine, and artificial intelligence. Our plan is to build a brigade of 137,000 community health workers by 2030. These workers are going to serve as a bridge between the community whom we serve and the formal healthcare system. Honorable Chairperson, this year in January, under my leadership, we secured $363 million from a non-traditional financer, the Republic of South Korea, for health system strengthening on favorable terms of 0.01% interest, 15-year grace period, and 25-year repayment. This innovative financing will transform Muhimbili and its satellite facilities into a regional hub for preventive, protective, curative, and rehabilitative services, aligning very well with the GPW 14 objectives. If elected, I will endeavor to engage such non-traditional funders from within our region and outside the continent. In the research and advocacy domains, I co-investigated HIV vaccine trials in Tanzania and Mozambique in the early 2000s. Later in 2012, my advocacy led to the then sitting President Jakaya Kikwete to publicly undergo HIV testing. This reduced stigma inspired 5 million Tanzanians to seek counseling and testing within a year. Likewise, the story repeated itself. In 2021, President Samia Suluhu Hassan openly championed and publicly received the COVID-19 vaccine, significantly increasing its uptake across the country and reducing infodemics. My second point is emergency preparedness. In 2015, the UN Secretary General Ban Ki-moon appointed President Kikwete to lead a UN high-level panel on global health crises after the Ebola outbreak in West Africa. As a senior advisor, I visited the affected countries of Liberia, Guinea, and Sierra Leone, gaining invaluable hands-on experience, and the panel's recommendation contributed to the efforts to transform the WHO approach to managing emergency crises that we observe today. My third point is on demographic response. The African continent is experiencing a demographic transition with its youthful population, offering both opportunities and challenges. Now, when you have a young population, it can drive growth and innovation. It's also highly exposed to risk factors such as substance abuse, unprotected sex, teenager pregnancy, mental health disorders, to mention a few. On the other side, As the population ages, it is crucial to prepare our healthcare systems to address the needs of older generation. My fourth point is on fresh perspective. I am ready to champion fresh ideas and innovative approaches that can revitalize our organization and drive impactful reforms. My work in Tanzania, advancing PHC, along with my experience abroad, has given me a first-hand insight into the barriers to healthcare access and the profound impact on our communities. Honorable Chairperson, the challenges ahead are so broad and multifaceted. A member state or any organization cannot manage on their own. To address them effectively, we must act together in bilateral and multilateral relationship. I'm committed to addressing the challenges by focusing on my 7 key priorities presented in no particular order. My first priority is universal health coverage and the SDGs. With less than 5 years remaining to achieve the SDGs, many indicators show we are off track on achieving them. In our region, for example, the universal health service today is 46, while the global index 68. Globally, today, 4.5 billion people lack full access to essential health services, half of the world, with 1 billion experiencing catastrophic out-of-pocket expenses, pushing families into poverty. I'm committed to the achievement of universal health coverage. My second priority is sustainable financing. Our current financing model faces persistent challenges, worsened now by the acute shift of global financing policies. Currently, 80% of the WHO budget relies on voluntary contribution, many of which limit our autonomy of earmarking because of earmarking. Member states' assessed contribution is only 20%, and sometimes even less. So sincerely, I support efforts to increase the assessed contribution, which is